Amriteshwari Nama. With great excitement and honor, we welcome you all to the fourth section of Rasamritam, Thought-Provoking Talk Series on Rasashastra and Kalpana. Today's section on Clinical Rasashastra by Dr. Rajmohan V, Associate Professor, Department of Rasashastra and Bhaishajya, Government Ayurveda College, Trivandrum, on the topic Essential Aspects in Pediatric Drug Development and Administration, Part 2. Now, I invite Dr. Rasamritam V, Principal in Charge and HOD, Department of Rasashastra and Bhaishajya, Amrita School of Ayurveda for the opening address.
Namaste, Manala. Namaste, Rajmohan sir. Yeah.
Namaste, sir. Namaste.
So I don't.
Namaste, sir. Namaste.
I don't think I need to have a opening remarks. It's basically a continuation of series. The first talk, as all of you know, was very impressive, and with your demand only, we are moving for the second session. Hope all of you will enjoy it. And I wholeheartedly welcome Dr. Rajmohan sir for this session. Thank you. Welcome, sir.
Thank you, sir. Thank you. Okay. So we have gone through all these basic concepts. I hope you are all remembering that regarding the basic concepts of the pediatric drug administration. I can see it is slowly coming. Yeah. We have taken all these basic considerations and just moving through the slides so that you can remember the very basic concepts. Today's class, I think it's only last for 30 minutes or so, we can have an interactive session on what we have discussed. Okay. This table is very important as far as R&B persons are concerned because it is right away regarding the absorption and absorption of dissolution and absorption of drugs. This is very important. Toxicological aspects. This we have discussed. This also we have discussed. Classification, age-related classification, we have discussed Jada Matran, Pakshadivan, Adipakshan, Trimasigan, Shanmasigan, Ekabdan, Traibdan, Panchahayanan, Ashtabdan, Dashabdan, Dwadashabdan. Up to 12 years of age, Arogya Kalpadruma considering up to 12 years of age as children. Okay. So again, this is very scientific. So two textbooks. One is Karshika Samhita and the other one is Arogya Kalpadruma. Both are giving us maximum information regarding what should I say, regarding the pediatric dosage forms and their administration. In particularly Arogya Kalpadruma in Kerala context, it is very relevant because as you know, the Kera Taila is coconut oil, which is having more of medium chain triglycerides. We have short chain triglycerides, long chain triglycerides, and medium chain triglycerides. Short chain triglycerides not that much healthy, and the long chain triglycerides are very healthy as well. And medium chain triglycerides are in between. So this coconut oil, it is easily digestible, easily absorbable because it is having medium chain triglyceride, which is similar to olive oil. And we Keralites probably purchase even olive oil, even though we are having coconut oil. Coconut oil is having properties very similar to olive oil in terms of its fatty acid composition. Maybe olive oil contains some other chemical constituents of both these oils might be different, but the usage over skin both are just like similar in properties because since both are having medium chain triglycerides, the absorption and all are pretty high than the other oils. Again, while considering all these things, you can see in Arogya Kalpa Drumam, there is maximum number of Keratailas are explained. Everything is mentioned as Thailas are mentioned as Snehas are mentioned as Kerataila. So that is the importance of Kerataila. Kerataila can be used as a skin lubricator, and as well as you can, it's a skin moisturizer. So several applications are there for Kerataila, and you can also make some creams, gels based on Kerataila again. So that is the importance of Kerataila, and that is the importance of it is well mentioned in Arogya Kalpatru. Okay, these are the factors. No need to stick to the dose for age in case of a child. That is very the avastha, Vyati avastha kala is more important than Kshanadi kala. That we always keep in your mind. Treatment for 7 days with kashaya, it should not be like that. You should stop the kashaya or you should change the treatment. Soon the necessity is over. Just like that. Soon the condition is traversed naturally. We have to start another medicine or we have to stop the medicine. And particularly, you have to tell patients not to share their medicines with the children, because always people think that Ayurveda is very safe, and it can also be it is very safe for children as well. So whenever we are prescribing some potent drugs, like commonly we are prescribing Vittumaram Guliga, Shwasanandam Guliga, Chikuntipilyadi Guliga, many contains Rasaushadis, and you have to tell patients specifically that this medicine is only for you. You should not share this with any other persons, and particularly with the children. Otherwise, what will happen is that the adult will share these kinds of medicines in the adult dose with the children, that can create issues. So that we have observed. Okay. Mother for drug delivery in neonate. We have already discussed that. The best way to administer medicine is, or if it is a powder, or if it is a churna, or any dosage forms, you make a paste of that and apply it over the nipple, and give milk to the baby. That will give. You can administer avalehas like that. You can administer krida like that. And if it is a Kshira, the baby, what we can do is, the mother should take the medicine, and for Nija Vigaras, the mother should take the medicines and feed give milk to the breastfeed the baby. So that is the basic approach. And if Aganda Vigaras are there, mother as well as the baby need to take medicines, because whatever mother is taking, that is available to the baby. So that approach is there in Kashipa Samhita as well as in Arogya Kalpadruma. Nija Vigaras of Alpadosha, Aushatha to mother. Nija Vigaras of Praputa dosha in Chirada and Chira Annada, Aushatha to both. Agam the Vigaras, Aushadha to baby, and Patyas to mother. That is more important. Aushadha to baby and Patya to mother. Usually in Chirada and Chira Annada, the above rule is followed, but it is particularly important in the first 15 days of life. Is there any issue? Am I audible?
Yes, sir. Yes, sir.
Somebody raise your hand. Yeah.
Yes, sir.
I'm so sorry. I think something is happening in the background. Some program is going on by the students. Am I clearly audible? Some background noises are there.
No, sir. Clearly audible.
Yeah. Okay, then it's fine. So was that problem from my side? I lost connection and all, or is there? അവിടെ എന്തെങ്കിലും പ്രശ്നം ഉണ്ടായതാണോ അതോ okay maybe my connection person. Let me connect once again. Okay. Now I need screen sharing.
Yes, sir.
Yeah, for both. I'm sorry.
For both.
Okay. Yeah. It's okay. So we have already discussed the problem with the Sorasa. Sorasa contains too much of suspended particles and we cannot make the Sorasa completely sterile. If you are administering it to a neonate, it can create some issues. The Sorasa can be, if it is there in the intestine, if you are giving too much of Sorasa, it can produce a lot of flatulence in the baby. Because, these cellulose can ferment it and it can produce issues in the stomach. So application of Sorasa in a neonate up to 15 days or so, you should be very careful because it is not a Sorasa, it's not a completely sterile preparation. And as we know, as far as Ayurvedic classics are concerned, it is Guru and mostly used as Vyadhi Viparita. Difficult to make the preparation sterile. So that is one of the major issues. We already discussed that the preparations to a neonate or a baby should always be very sterile. Controlled using Shira Annada. For Shirada, as far as possible, you should avoid Sorasas and extensive use in Annada onwards. The same is applicable for Kalka. We already discussed that, so I will move to Kashaya. As I have explained, most extensively used dosage form in Kaumara Pritya is basically Kashaya. Concentration and dose should be low when compared to adult. It's always, if you specifically want to give a Kashaya, it is always better to take a full-blown Kashaya. That means the drug concentration 1:16. That drug concentration is we can give only to a child when he reaches the another thing. Otherwise, you have to reduce the initial drug concentration. That instead of adding 1 pala and taking 16 pala, you have to reduce it to half pala and 16 palas of water. Just like you reduce the drug concentration, it is comparatively sterile. Can be used right from the birth. Extensive use after 15 days of birth. And again, Shita Kashaya, when you go through the Arogya Kalpadruma and Kashyapa Samhita, Shita Kashayas are not much explained in the context of pediatric dosage forms, but it can be used depending upon the right from the birth, and try to ensure that Shita Kashayas are very sterile. But when it comes to fandom, that is the Fanta Kalpana, it is the ideal preparation for a baby or for pediatric use. Fanda is otherwise known as Churna Dreva. Churna Dreva means it is a Dreva of the Churna. Even, when you can, you want to give Hingoshta Churnam or Hingojadi Churnam to a baby, what you can, you make it into a Fanda, you pour hot water to that, you collect the Dreva, and you can even administer it in dose, administer in drops, 3 to 5 drops to a baby, depending upon the age. So the most ideal preparation as far as pediatric dosage forms are concerned, it is no doubt it is Fanta Kalpana. In Kashyapa Samhita, it is specifically indicated that Kvata should be prepared as Fanta, as per Fanda Vithi for administration in children. So comparatively sterile, easy to prepare, can be used right from the birth, and extensive use after 15 days. Up to 15 days, I already told you how to administer medicine. The mother is mainly going to be the drug delivery method for the baby. Gudika, Vadi, etc. Basically, Gudikas and Vadis are the alternate forms of Churna, and same as Churna, usually much better particle size. Controlled use in any children as they are usually highly potent, must be suspended or dissolved in proper media before administration. So, Gudikas and Vadis are, even though they are alternative to Churna Kalpana, but the potency of the medicines inside a Gudiga and that Vati are always higher than that of a Churna. You can give Talisa Patra Churna is a comparatively better dose, but you always remember that Vitavan Gudiga is also a Gudi. It is not merely a conversion of the Churna of Vitavan Gudiga into a Gudiga. But in order to deliver an accurate dose, we have converting that into Gudiga or Vati or tablet or whatever it may be. So even though Gudigas and Vadis are considered to be an alternative to Churna Kalpana or a modified form of Churna Kalpana or Kalka Kalpana, the dose should be very careful, and that's why majority of them are Vyadhi Virida, so that we cannot directly administer in a Kshirada and all. So be very careful, and whenever you are administering a Gudiga or Vati, it is not as equivalent as a modern tablet that you can simply swallow it using water. The Gudigas or Vadi should be, ground thoroughly with any media, just like honey or ardragasas or whatever it may be, and that should be administered to anyone with an Anupana or Sahapana. And whenever you are administering this Gudiga or Vati to children, you should take specific care that the media are also very sterile. Modagas are Modaga, Gudiga, Vati, Varti, all are synonymous to each other, but their purposes are different. Basically, Modaga, the term itself is not is for telling that it is for Karshana. The best example of a Modaga is a Letu. The Letu is a Modaga. And Sri Ratna Modagam is there. Priyala Majjadi Modagam is there. All these appearing with the Modaga, they are all food formulations basically, and not per se they are medicines. So Priyala Majjadi Modaga is a weaning food that is given to children around 6 months of age. So infants around 6 months of age. So Modagas are widely explained in children mainly for nutritive purposes. And Vadiga, Yoshadi Vatagam is there. Vatagam, as you know, that it is also having a local effect. It is also having a local effect on your throat and all. And Khandam is there because it looks like Khandasita and all. Again, the local effect is very important, like as in Hardra Khandam. Varti, Varti, the shape is just like Varti Shishna Varti and all those things there because you can place it in a cavity. And then comes Pindi is there. It's just like a Pindi, and Vidalagam is for, you have to triturate in an appropriate medium and apply over an area. So even though these are all synonymous terms or preparation is same as that of the Gudiga or Vati, based on the application, the name also changes a little bit. So that is there. They need to appropriate medium for their use. And they are reasonably palatable, usually given during weaning. That is the use of Modaga in children. Then comes Krita and Thaila. Internal administration of butter or plain ghee is indicated right from the birth. Krita for treatment can be used from Chirada. Extensive use from Chira Annada for the preparation of Thaila Paga. Coconut oil is more beneficial, as I already told you, because of the absorbability of coconut oil is comparatively better. This principle has been used in Arugya Albadruma. So internal administration of butter and plain ghee is indicated right from the butter is much better because butter is a it's a cream which contains water as well as it is already emulsified. It contains cream. It contains oil globules embedded in water. So the absorption of butter is somewhat better than ghee. And ghee, Chira another is the best option to give Krita preparations because you know that bile is initially absent in a neonate that has to be catch up with an adult stage very later in life. So that you have to keep in your mind. So the dose should be very balanced. If better, you can mix it with the stanya and you can give. That is on best way to give Sneha Kalpana. Avaleha is palatable formulation, sterile preparation, if freshly prepared, controlled use right from the birth, extensive use from Chira and Nada. All these formulations are better, can be given to a baby, infant from the Chira and Nada stage. Must need appropriate media for reducing consistency. Pharmaceutically, honey is best in this regard. The best medium of administration as far as Kashirasa media is concerned to a child is definitely it is Madhu. Even you are giving an avaleha, even you are giving a churna or a gudiga or vati, honey can be taken as a best medium for Chira and Nada onwards. Avaleha preparations are very limited use in prior to in Chira the state. Arishtasavas generally not recommended in any of the classics. When you go through the classics, only a couple of Arishtasavas mentioned for infants and young adults or children, as in Aravindas, as in the case of Aravindasava or Saraswata Arishta. A very few number of medicines are explained, but generally are not recommended in any of the classics. Palatable preparations, diluted dose can be given to Chira and Nada, or even in Chira, the extensive use only from Annada. Usually, personally, I suggest for Pitta Prakriti persons and all, always I prescribe Arishtasavas with the equal quantity of boiled and cooled water. Or the same thing can be applicable to you. Fix the dose for a baby, 1 teaspoon or half a teaspoon. That depends upon the age of the child and as well as the state of Agni. And you can add equal quantity of water, dilute it and administer it, so that will protect it. If Paichidhatva is there, somehow we can balance it. So that is the use of Arishtasavas, extensive use from Anna. Arka preparation, one of the ideal preparations in children which can be used for different applications. You already know that gripe water is there. Majority of the carbonated mixtures presently we are available in the market. We are giving for infant for that burping and all, or regurgitation and all. They are all Arka preparations which are taken from Aimodaga. Aimodaga Arkam is one of the best carbonative thing available, and it is this apiol mixture is available as carbonatives. So one of the ideal preparations in children which can be used from different applications, completely sterile preparations, because since we are using a sterile method, distillation is one of the methods by which we can make things very sterile. Better accepted by the baby, controlled using Chira and extensive use from Chira and Naga, that is the Arka. So now we have many Arka preparations available. Many are preparing and giving Arkas. So there are several drugs which can be amenable to Arka preparations. Not all drugs can be prepared Arka. Whenever you go for Triphala and all, Triphala Arkam is there. We have observed that it is not that much effective than when compared to the classical parent form of Triphala Churna. But there are certain things like APSA family drugs, just like Jeeraga, Karin Jeeraga, or Chatakuppa, or Ayamodaga. All those things, you will have a good Arka you can get because the volatile oil content is very high. Those kinds of drugs which these volatile principles are very high, that can make better Arkas and can have better effectiveness when compared to other forms of the same drugs. So ARCA, there is a definite role of ARCA in pediatric management. So you can have research works based on ARCAs that can be given to pediatric formulation. Chara and Levana, basically Chara and Levana, it is not indicated in Chirada and Chira and Nada. Yeah, because these are all Vyati Pidita preparations and only controlled use is welcome in Annada onwards. Kshirapakas, usually Tikshna Aushadas are processed in milk for accurate potency for Vyati Pidita purpose. The use is minimally explained for children, can be used from Chirada depending upon the drug. So, only Chirapagas are, we are administering Chirapagas to Garphini. There are Masa and Masa Valarcha, Chirapagas are mentioned for specific conditions that is arising in Garphini. Month-wise conditions arising in a Garphini. Matugam, Shaga, Pijam, Chapaisya, Surada, Arija, that yoga, that sloka is there in Ashtanga Hridaya, which clearly explains month-wise Chirapaga that can be administered in a Garphini. If something is administering in the Garphini, you can also administer the same in the baby as well, infant, neonate, and infant as well. But depending upon the condition, you balance it. And specifically, Pisces Thirasitam is applicable to Garphini as well as, their pe shushkedu vadena, balanam cha vishushidam. The same sloga is there. That is also applicable to babies. That is also applicable to, you can give that to babies as well. The use is minimally explained for children, can be used from, even though it is minimally explained in the classical textbooks for application children, depending upon the condition as well as the drug, we can utilize it much wider. Some other dosage forms, Thupana, disinfectant and antimicrobial things, Thupana and Varti rectal route of administration. Nowadays, Vartis are more preferred, the suppositories are more preferred for, the easy, prepared as a easy route of administration for infants and all. It's developing and we don't have that much of data suggesting that our kashayas can be converted into Varti with improved effectiveness and all. We need to have that study should be there. We don't have anything positive till now for at least extensive application of Varti in rectal route of administration in children as far as Ayurvedic books are concerned. Thupana can be done. Herbominerals in children. Herbominerals are highly potent and mainly used as Vyati Virida. It is very clearly explained in the science that it is mainly focusing on Vyati Virida as Vyati Virida. The Vyati Virida Aushadas are generally contraindicated because can interfere with the growth and development of the children. So try not to prescribe, very potent drugs in Annada. In Chira and Chira Annada. We can use herbomineral preparations very extensively from Annada onwards and Chira Annada in a limited manner. Herbomineral used for treating the disease in children minimal. There are Kumara Kalyana Rasa is there and some other drugs are also there which is specifically indicated for use in children. But majority of the Rasa Aushadhis, they are not, it is not indicated in Balarogas. Standardization of those in children are very difficult with Rasa Aushadhi, that's one of the things. Use of herbomineral should be suspended in Chirada and using Chira Anna should be a last choice. Common preparations which are having wide practice can be used in Annada. So Annada onwards, herbomineral formulations we can use comfortably. That's my observation because I have gone through many of the Rasa textbooks and there were not much Rasa Aushadhis mentioned specifically for Chirada and Chira Annada. And the children, they are, I think they are mainly mentioned for conditions of children over 12 years of age or so. So that is the thing I have observed. The heavy metal associated with the herbomineral use is also, a concern for an infant. I already told you the heavy metal metabolism in the metabolic pathways are still developing at that age. So be very careful while we are giving drugs in Chirada specifically. And again, external applications are very well. You can use external applications effectively in children because skin can be a better route of administration in children. But for adult, skin is a better barrier. But in an infant or in a young child, naturally it cannot offer that much of barrier, because the development of the cuticle, the development of the skin is in a premature stage. The ratio of skin surface area to body weight of an infant is 3 times greater than that of an adult. So something you are administering over the skin, its rate of absorption is 3 times higher than that of an adult. So always keep in mind that it's an external application, but the absorption can be much higher in an infant. Low thickness of the stratum corneum, perfusion is more when compared to adult. Careful selection of formulation is needed to avoid complications. So again, some potent drugs. You always keep, while you're administering Jatyadikritam in an infant, you keep in mind that it contains copper, and naturally, the absorption through the skin is very high. That doesn't mean that you should not use Jatyadikritam in an infant, but that thinking should be there. Whenever you're administering some, Rasau should be containing, particularly arsenic containing formulations as external applications. You always keep in mind that, that if the area of application is very high, there is high chances of this thing to be get absorbed in the body and can, create some issues. So always keep this in mind. It is there in the modern medicine as well. Whenever some external applications are given to the baby, they will take extreme care. And I already told you, while you are using some pesticides, you always keep that you should not use in the vicinity of an infant or a neonate, because the absorption through the skin is very high. That can create issues. So careful selection of formulation is needed to avoid complications. More accepted products, food used as drug delivery system in children. That's why, Sabhaktam is the best, Bhaishajya for administration of drug to a child. Sabhaktam means Annena Sathidam Paschatva Samalodhidam. So you mix, medicine with food. That is important, and it should be very careful, because the baby may be very particular with some of the food. So you are mixing some churnas or some kritas with the food, and they may lose their interest towards that food. That is a dangerous thing. So it should not, per se, it should not totally alter the taste of the food. So be very careful. You can mix the food, but adding Indugandha Kridam in milk, or adding Indugandha Kridam in chapati, or adding Indugandha Kridam with some of the curries, all those things are accepted, because that is the best way in which you can give some medicines to the babies. Then use of tablets, capsules not recommended under 10 years of age, because the swallowing is very tough. Lozenges, granules, lozenges are chocolate like things. So all those things are very accepted by the students. Granules you can give. Granules are you can mix it with milk and you can administer. Modified arcas. Arcas can be modified as sterile preparations into drops. You can mix it with. You can add Kantasita to that, and you can make it much more palatable. Churna and Kwafa with the churna. You can fortify products with Bhavana, and you can reduce the dose. And again, you can, Samshamini Vadis are there. Samshamini Vadis are basically, the base is going to be Guduji Sattva or Guduji. And you can, 50% of Guduji Sattva with 50% what? Pettumaram Guliga can, that means the dose of the herbomineral is comparatively reduced, and you can give it for Jara in children. So that, the herbomineral formulation is there, but not as equivalent as an adult dose. So likewise, you can modify some of our formulations. You can think about modifying some of our formulations so that it can easily be applied in children. So that is another thing. The media of drug administration is also important. They can be used to enhance the therapeutic activity of the dosage form for increasing palatability or growth. In a child, it can serve some nutritional purpose as well. Honey, ghee, breast milk, sugar, etc. can be used appropriately. This is explained in Kashita Samhita. In Kashita Samhita, the primordial thing is that whatever you select, it should not be in contrary to the condition, the condition of the baby. It should not be vidutha to the condition of the baby. So there is a Vadika condition and you are giving honey, and there is a Kafaja condition you are selecting tea as the thing. So you select for a Kafaja condition, you select honey as a medium. Likewise, you select wisely depending upon the condition of the patient. Sometimes you can take honey and heat together, as in the case of Sutopalari Churna or Padisavatari Churna. Likewise, the media for drug administration is having great importance in children, so that can improve the palatability. That may use of administration, so everything is there. So that is it. And breast milk, ideal media for drug administration in a newborn is explained in various textbooks of breast milk. Milk is the most acceptable substance to the GI tract of a baby, which you all aware. Milk is an emulsion which can carry water soluble as well as fat soluble components, well tolerated by the baby, and nutritional aspects are maintained as well. So the initial stages of life when the baby is, bringing breast milk, breastfed, naturally, majority of the medicines you can mix with breast milk and give. So that itself is the breast milk is can form a very good medium. Then next is honey. Honey can be used for effective delivery, specifically churnas at any age, because you can see that churnas will be even if it is Rasashastra with high specific gravity, that can easily be suspended in honey. You cannot mix it in any kashayas, and if you mix Rasashastra in kashaya and you drink, you can see at the end you will find the Rasashastra at the bottom of the glass. But you triturate it with honey, you can easily suspend that in the honey, and you can easily take it easily. So that is regarding honey. Water soluble drugs get syrupy nature. Churnas can effectively suspended in honey for uniform distribution here, right? Fructose and glucose present in the honey serves as those nutritional purposes as well. And also, that honey is a powerful, antioxidant, which contains many beautiful compounds which can act as free radical scavengers and, with a very high therapeutic potential as well as other beneficial and other benefits to our body. Krida serves as nutritional purpose very well. It cannot be used in all conditions as we have discussed. Not so ideal in early months, as fat is not well tolerated in all due to reduced lipase activity and decreased bile secretion. These two things are there because Krida preparations are not well tolerated in the early stages of life because of absence of bile secretion and as well as pancreatic lipase activity. That is also very thin. Panchakarma and Rasayana therapy in children, Shodhana Aushadha should be administered with high care in children. Vastin Sathe Viregayana Marsyana Pradimarsanam Jeye. Instead of Pradimarsanasya, we have to administer Pradimarsya. And instead of, Vasti, Virejana, we should administer Vasti because Vasti is much safer than Virejana. Because Virejana, the medicine has to be digested. And once the medicine is digested, you don't have any control over that Shodhana Prakriya. But Vasti, if it is, Vasti and Vamana, the medicine we are administering is coming out. So that is the advantage of Vamana and Vasti. So Vasti is comparatively a safer procedure than Virejana. Virejana is considered to be a tough Panchakarma procedure, and it is not indicated in children as well as in elderly. And even in Vada Vyadhi, it is Durbalo Yo Virecheha Satyam Niruhe Rupajare. If someone has to do a Virejana, if that person is Durbala, you have to administer Vasti. So Shodhana should be administered with high care in children. So Virejana, most of the time it is not possible in an Annada. In Shirada and Shira Annada, we don't have that much of options. But in Ashtanga Hridaya, for Pupuna Chikitsa and all, it is clearly explained. Uttha Shodhana is explained there. Naimittika Rasayanas may be used for the treatment of diseases in specific conditions as last choice. Rasayanas, we already told that they are Vyadhi Piriva, they can interfere with the Laphovayohi Sastan. Rasayana, Laphovayohi Sastan, and Rasadina and Rasayana. They are specifically indicated for conditions wherein there is Dhatu involvement. But that's why they are Vyathyavastha. And Vyathyavastha medicines are contraindicated. So also Vajikarana Ausayas are contraindicated. And Rasayanas are generally contraindicated. Purve Vaisi Natyava Palpravijya, Siddha and Ha. Naimittika Rasayanas, if there is a specific condition in which the child needs a very potent medicine, at that time we may consider the growth and development over the disease to save the life of the baby. In that condition, we can give potent drugs like Rasayanas. Preterm and low birth weight babies, everything we have discussed is for term infants. So behavior of our dosage form in the immature anatomical and physiological systems of the above group should be separately be considered. A detailed scientific evaluation is necessary. How we should adjust the dose for a preterm baby, a baby born in 7th month or 7.5 months. So naturally, the full age is not yet attained. So what should be the criteria and how the GI tract will be developed? So all those things we need to consider, and we have to make changes of our dosage forms accordingly. I don't have any specific suggestions for this particular thing. And possibilities, need for ideal medication in the pediatric field is underserved throughout the world. Now also there is a lot of issues regarding the pediatric drug administration. Suppositories are coming, and they are trying to modify with minimal, problem with minimal complications. But still, throughout the world it is underserved, and I think earlier, before 10 years or so, there was not much options, but now suppositories, I think they are focusing more in the suppositories. These are the things. This is only I need to suggest you all are there for suggestions of this thing. Invite your opinion as well as your queries. Please go through. Thank you.
Thank you, sir. Thank you, sir, for the valuable knowledge. We look forward for further sessions from you, sir. Now the session is open for queries. Any doubts?
Any doubt, please? Do you have any queries? Definitely, there must be some, but I think they are a bit reluctant to ask. Please.
Good afternoon, sir.
Good afternoon.
നമ്മളിപ്പം പീഡിയാട്രിക് ഹോസ്പിറ്റലിൽ ഒരേ കൊടുക്കാൻ പാടുണ്ടെന്നാണ് പറയുന്നത്.
കേൾക്കുന്നില്ല, ഒന്നും ക്ലിയർ ആവുന്നില്ല എനിക്ക്. ഒന്നുകൂടെ പറയൂ പ്ലീസ്. പ്ലീസ്.
സാർ, ഇപ്പം നമുക്ക് ഡെലിവറി കഴിയുമ്പോഴത്തേക്ക് പീഡിയാട്രിഷ്യൻ ആണെങ്കിൽ നമ്മളോട് പറയുന്നതെന്ന് വെച്ചാൽ ഒരേ മരുന്ന് കുട്ടികൾക്ക് കൊടുക്കരുത്, അങ്ങനെ ചെയ്യിച്ചിട്ട് പാടില്ല എന്നാണ് എപ്പോഴും പീഡിയാട്രിഷ്യന്മാർ പറയുന്നത്.
അങ്ങനെയല്ല, നമുക്കതിനകത്ത് ഇപ്പൊ ആയുർവേദ മരുന്ന് കുട്ടികൾക്ക് കൊടുക്കരുത് എന്ന് അവര് പറയുന്നതിന് പ്രത്യേകിച്ച് സയന്റിഫിക് ബേസിസ് ഒന്നുമില്ല. ആയുർവേദ മരുന്ന് ഒരു നിയോനേറ്റിന് അല്ലെങ്കിൽ നമ്മളുടെ കുട്ടികൾക്ക് ആയുർവേദ മരുന്ന് അതിനുശേഷം കൊടുത്തു എന്ന് കരുതി കുട്ടികൾക്ക് എന്തെങ്കിലും സംഭവിച്ചായിട്ട് നമുക്ക് അറിയില്ല. പക്ഷെ നമ്മൾ കുട്ടിക്ക് ഒരു ആയുർവേദ മരുന്ന് കൊടുക്കുമ്പോൾ അതിന്റെ ശാസ്ത്രീയത മനസ്സിലാക്കിയിട്ട് വേണം നമ്മൾ കൊടുക്കേണ്ടത്. നമ്മൾ ഇവിടെ പറഞ്ഞപ്പോൾ ഒരുപാട് ഫിസിയോളജിക്കൽ ആൻഡ് അനാട്ടമിക്കൽ കൺസിഡറേഷൻസ് ഒക്കെ നമ്മൾ പറഞ്ഞില്ലേ. ചൂർണം എപ്പോൾ കൊടുക്കണം, കഷായം എങ്ങനെ കൊടുക്കണം, അല്ലെങ്കിൽ സ്വരസം നമ്മൾ കൊടുക്കുമ്പോൾ ശ്രദ്ധിക്കേണ്ട കാര്യങ്ങൾ. അപ്പൊ നമ്മളൊരു ജനിച്ച ഉടനെ ഒരു കുട്ടിക്ക് എന്തൊക്കെ കൊടുക്കാൻ പറ്റും, ആ കൊടുക്കുന്നത് എങ്ങനെ വേണം നമ്മൾ കൊടുക്കേണ്ടത് എന്നുള്ള കാര്യങ്ങളൊക്കെ വെച്ചുകൊണ്ട് നമ്മൾ കൃത്യമായി കുട്ടിക്ക് കൊടുക്കാം. പിന്നെ ഒരു കാര്യം എനിക്ക് പറയാനുള്ളത്, നമ്മളൊരു ഡോക്ടറുടെ കെയറിൽ ഇരിക്കുമ്പോൾ ഔഷധം കൊടുക്കണോ വേണ്ടയോ എന്നുള്ളത് ആ ഡോക്ടറുമായി ആലോചിച്ച് ആ പേഷ്യന്റ് എടുക്കേണ്ട തീരുമാനമാണ്. നമ്മളൊരു ജനറലി എനിക്ക് പറയാനുള്ളത്, ഒരു കുട്ടിക്ക് വളരെ കൃത്യമായിട്ട് നമ്മൾ ഈ പറഞ്ഞ കാര്യങ്ങളൊക്കെ നോക്കിക്കൊണ്ട് ഒരു മരുന്ന് കൊടുക്കുന്നത് കൊണ്ട് ഒരു തെറ്റും ഒരു പ്രശ്നവും കുട്ടിക്ക് വരാൻ പോകുന്നില്ല. പക്ഷെ ആവശ്യമുള്ളത് മാത്രമേ കൊടുക്കാവുള്ളൂ. നമ്മളിപ്പോ നമ്മളുടെ തന്നെ പല പ്രാക്ടീസുകൾ, നമ്മളുടെ തന്നെ ഈ പ്രസവരക്ഷ സംഭവങ്ങളൊക്കെ തന്നെ നമ്മൾ തന്നെ ഇവാലുവേറ്റ് ചെയ്തിട്ടുണ്ട്. പലതും ഒരു എങ്ങനെ ഇങ്ങനെയുള്ള പ്രാക്ടീസുകളൊക്കെ തുടങ്ങി നമുക്കറിയില്ല. നമ്മുടെ പുസ്തകത്തിൽ പറയുന്നതിനെയൊക്കെ അപ്പുറത്തേക്ക് മാറിപ്പോകുന്നു. അതുപോലെ തന്നെ നമ്മൾ കുട്ടികൾക്കൊക്കെ നമ്മൾ ചില മരുന്നുകൾ കൊടുക്കുന്നതിനൊന്നും യാതൊരു റാഷണാലിറ്റി നമ്മൾക്ക് കാണാൻ കഴിയുന്നില്ല. അപ്പൊ ശാസ്ത്രീയമായി പുസ്തകത്തിൽ പറഞ്ഞിരിക്കുന്ന തരത്തിൽ നമ്മൾ കുട്ടികൾക്ക് കൊടുക്കുന്നത്. അപ്പൊ കാശ്യപ സംഹിതയിൽ വളരെ കൃത്യമായിട്ട് പറയുന്നുണ്ട്, നല്ലതുപോലെ പാല് കുടിക്കുന്ന, ഭക്ഷണം കഴിക്കുന്ന, മറ്റു പ്രശ്നങ്ങളൊന്നും ഇല്ലാത്ത കുട്ടിക്ക് നിങ്ങൾ ഒരു മരുന്നും കൊടുക്കേണ്ട കാര്യമില്ല. കാര്യം ആ കുട്ടിയുടെ ശരീരത്തിന് തന്നെ കുട്ടിയുടെ പ്രശ്നങ്ങൾ മാനേജ് ചെയ്യാനുള്ള കഴിവുണ്ട്. അപ്പൊ ആ ചോദ്യത്തിനുള്ള ഉത്തരമായി തോന്നുന്നു, കുട്ടിക്ക് മരുന്ന് കൊടുക്കണമോ വേണ്ടയോ എന്നുള്ളത് പീഡിയാട്രിഷ്യന്റെ കെയറിലായിരിക്കും. അവരുടെ അഭിപ്രായം എടുത്തുകൊണ്ട് ആയുർവേദ മരുന്ന് കൊടുക്കണോ വേണ്ടയോ എന്നുള്ള തീരുമാനം പേരന്റിൻ്റെതായിരിക്കും. പക്ഷേ കൃത്യമായി വ്യവച്ഛേദിച്ച് കണ്ടീഷൻ അനുസരിച്ച് നമ്മളൊരു ആയുർവേദ ഔഷധം ഒരു കുട്ടിക്ക് കൊടുത്തു എന്ന് കരുതി, ഞാൻ ഈ നേരത്തെ പറഞ്ഞ കണ്ടീഷൻസ് കൊടുത്തു എന്ന് കരുതി കുട്ടിക്ക് ഒന്നും സംഭവിക്കണം.
താങ്ക് യു സർ. സർ, നമ്മളിപ്പോ പറഞ്ഞല്ലോ അമ്മയ്ക്ക് മെഡിസിൻ കൊടുത്തിട്ട് ഫീഡ് ചെയ്യിക്കാൻ പറഞ്ഞല്ലോ. അപ്പൊ എത്ര മണിക്കൂറിനുള്ളിലാണ് നമ്മളത് ചെയ്യേണ്ടത്? അപ്പോൾ തന്നെയാണോ അതോ അങ്ങനെ എന്തെങ്കിലും ടൈം പീരീഡ് ഉണ്ടോ?
അമ്മയ്ക്ക് മരുന്ന് കൊടുക്കുന്ന അപ്പൊ ഞാനൊരു ഉദാഹരണം പറയാം. അപ്പൊ നമുക്ക് ട്രോമയൊക്കെ ആണെങ്കിൽ, കുഞ്ഞിന് ട്രോമയൊക്കെ ആണെങ്കിൽ നമ്മൾ കുഞ്ഞിനെ തന്നെ കെയർ ചെയ്യണമല്ലോ സ്വാഭാവികമായിട്ട്. ട്രോമ ഒരു ആലംബ വികാരമാണ്. നേരെ മറിച്ച് നമുക്ക് കുഞ്ഞിനൊരു സ്കിൻ ലീഷൻ ഉണ്ടായെന്ന് വിചാരിക്കുക. അതായത് ഇപ്പൊ നമ്മളൊരു നിയോനേറ്റിന് ഒരു 15-20 അല്ലെങ്കിൽ 1 മാസം 1.5 മാസം കഴിഞ്ഞ ഒരു കുഞ്ഞിന് ഒരു സ്കിൻ ലീഷൻ ഉണ്ടാവും, അല്ലെങ്കിൽ ഒരു അലർജി ഉണ്ടാവും, അല്ലെങ്കിൽ ശരീരം ഒന്ന് ചൊറിഞ്ഞു തടിക്കുന്നു. നമ്മൾ കുഞ്ഞിന് മരുന്ന് കൊടുക്കുന്നതിനോടൊപ്പം തന്നെ നമ്മൾ അമ്മയ്ക്കും മരുന്ന് കൊടുക്കണം. കാര്യം അമ്മയിൽ നിന്നായിരിക്കും ആ രോഗം കുഞ്ഞിന് കിട്ടുന്നത്. അതുപോലെ ഏറ്റവും നമ്മൾ ശ്രദ്ധിക്കേണ്ട കാര്യം വെച്ച് കഴിഞ്ഞാൽ കുഞ്ഞിനുണ്ടാകുന്ന ഡൈജസ്റ്റീവ് പ്രോബ്ലംസ്. കുഞ്ഞ് പാല് പ്രോപ്പറായിട്ട് ദഹിക്കുന്നില്ല. അതിന്റെ അർത്ഥം എന്ന് വെച്ച് കഴിഞ്ഞാൽ പ്രശ്നം കുഞ്ഞ് കഴിക്കുന്ന പാലിലാണ്. ആ പാൽ ആരാണ്, എവിടെ നിന്നാണ് വരുന്നത്? അമ്മയിൽ നിന്നാണ് വരുന്നത്. അപ്പൊ അമ്മ ദീപനപാചനമായിട്ടുള്ള ഔഷധങ്ങൾ, അമ്മ സ്തന്യ ശോധനമായിട്ടുള്ള ഔഷധങ്ങൾ കഴിച്ചുകൊണ്ട് വേണം കുഞ്ഞിന് പാല് കൊടുക്കേണ്ടത്. അതുപോലെ തന്നെ നമ്മൾ കുഞ്ഞുങ്ങൾക്കുള്ള ഔഷധങ്ങൾക്ക് രോഗങ്ങൾക്ക് ചികിത്സിക്കുമ്പോൾ അമ്മ പാല് കുടിക്കുന്ന കുട്ടിയാണെങ്കിൽ, ക്ഷീരാതനാണെങ്കിൽ അല്ലെങ്കിൽ ക്ഷീര അന്നാഥനാണെങ്കിൽ അമ്മ സ്തന്യ ശോധനമായിട്ടുള്ള ഔഷധങ്ങൾ കഴിക്കുന്നത് എന്തുകൊണ്ട് നല്ലതാണ്.
ചില കേസിൽ കോൺസ്റ്റിപ്പേഷൻ ഒക്കെ വരുമ്പോൾ ഡോക്ടേഴ്സ് അമ്മയുടെ അവിപത്തി ചൂർണം കഴിക്കാനൊക്കെ പറയുന്നത് കണ്ടിട്ടുണ്ട്. അപ്പൊ ആ അവിപത്തി ചൂർണം കഴിച്ച് എത്ര നേരം കഴിഞ്ഞിട്ടാ ഫീഡ് ചെയ്യേണ്ടത്? അപ്പൊ കണ്ടിന്യൂസ്ലി ഫീഡ് ചെയ്യാമോ അതോ?
ഫീഡ് ചെയ്യാനൊന്നും കുഴപ്പമില്ല. കാര്യം കുഞ്ഞിന് ആവശ്യത്തിനനുസരിച്ചാണ് കുഞ്ഞ് പാല് കുടിക്കുന്നത്. വിശക്കുമ്പോഴാണ് പാല് കുടിക്കുന്നത്. നമ്മളെ പോലെ ക്ലോക്ക് നോക്കിയല്ലല്ലോ കഴിക്കുന്നത്. അപ്പൊ അതൊരു ഇതല്ല. അതുപോലെ തന്നെ ഡയറ്റ് വളരെ ഇമ്പോർട്ടന്റ് ആണ്. ഇപ്പൊ കുഞ്ഞിന് കോൺസ്റ്റിപ്പേഷൻ ഉണ്ടാകുന്ന സമയത്ത് അമ്മ കുറച്ചും കൂടെ ഫൈബർ അടങ്ങിയ ഭക്ഷണങ്ങൾ കഴിക്കുക, അമ്മ ലാക്സേറ്റീവ് ആയിട്ടുള്ള സ്വപ്പം മുന്തിരി കഴിക്കുക, അങ്ങനെയുള്ള സാധനങ്ങളൊക്കെ അമ്മ പഥ്യം ആചരിക്കേണ്ടത് എപ്പോഴും അമ്മയാണ്. കാര്യം കുഞ്ഞ് പഥ്യം ആചരിക്കുന്നില്ല. കുഞ്ഞിന് പാല് കൊടുത്തേ പറ്റുള്ളൂ. ഞാൻ സൂചിപ്പിച്ചെന്ന് തോന്നുന്നു, ലംഘനം ചെയ്യേണ്ട സാഹചര്യത്തിൽ അമ്മ ലംഘനം ചെയ്ത് കുഞ്ഞിന് പാല് കൊടുക്കണം, അങ്ങനെ പറയുക.
Okay, thank you, sir, for the good insight. Wonderful insight.
Thank you, sir.
Sir, as a student, I just want to ask a question.
Please, sir, please.
With the invent
അറിയാവുന്നതാണെങ്കിൽ പറയാം.
With the invent of these modern pediatric medicines, with the addition of extracts, sir, how can we scientifically, ethically, because this session is more for ethical things, how can we ethically encourage our doctors to prescribe those things? Because the whole Ayurveda concept of preparation is not related to ethics, it's more of a dilution. Here, when they take the extracts, can we believe on it, or how far it is safe to use them? And the second part is whether we need to follow the dosage schedule of like Young's or Dilling's formula in these medicines, or we need to be careful.
Sir, application of Young's forms and Dilling's formula as far as Ayurvedic principles are concerned is limited application, because it depends upon many factors of the baby, acne of the baby, and everything we should consider. That is the first thing I have to tell. So we may use it as a clue in the Young's formula and Dilling's formula. We may give that, of course, 2 ml of kashaya may be necessary, 5 ml of kashaya may be necessary. So based on that average dose, we need to adjust. Maybe we can administer 8 ml, or we reduce much thing. Regarding extracts, sir, it is definitely that is going to create issues. In an adult, there are sufficient enough mechanism from the body to neutralize if there is any overdosage of a specific phytoconstituent is available in a particular formulation. But when it comes to baby, particularly Chirada and all, there may not be that much of mechanisms available so that it can neutralize or metabolize properly. So how we should administer these? Phytopharmaceutics are, there are a group of drugs coming up, which are known as phytopharmaceutics. The phytopharmaceutics, they are focusing on at least one or two active constituents they have to specifically mention, and they also need to mention how much quantity of this phyto constituent is available in this formulation. So it's a highly standardized herbal medicine is phytopharmaceutics. So then what they have to do is they have to do the bioavailability studies. What is the dosage of this particular medicine according to the bioavailability? So you have to study the pharmacokinetic studies, plasma concentration, Cmax, Tmax, T half, everything. So once that data is available, then only we can calculate the exact dose for a child in that thing. So merely reducing to half, or merely reducing to 1/4 of an adult dose, or merely reducing to just like reducing the adult dose to child dose by Billings formula, or all those things won't work in case of extracts and all. Maybe it can create issues because the physiological system may not work as equivalent as adults. That's my catch. As you thought, definitely that can cause issues in children.
With this, we conclude today's section. Hope the discussion was helpful. Thank you once again.
Thank you, sir.